But first to the lockdowns that see half of Australia's population under stay-at-home orders. And it's becoming abundantly clear that there is no plan B to the eradication strategy, the zero COVID madness that states are striving for right now. How much more damage to the state is the New South Wales government willing to inflict to achieve its zero COVID goals? How much mental and financial hardship are they willing to inflict to reduce COVID cases down to zero? Right now, Australia has become the subject of mockery around the world. Clips from Australian news services are going viral. People overseas are shocked by the hyperbole and the hysteria that we have become accustomed to. Also going viral in New South Wales is New South Wales Chief Health Officer Kerry Chant and her advice to ignore your neighbours at Aldi.
Whilst it is in human nature to engage in conversation with others, to be friendly, unfortunately, this is not the time to do that. So even if you run into your next door neighbour in the shopping centre, in the Coles, whilst you're at Coles or Woolworths or Aldi or any other grocery shop, don't start up a conversation.
This is no time to be friendly, folks. That sort of advice, that's reminiscent of the Victorian government's Orwellian slogan, staying apart keeps us together. One day we're going to look back at this time and wonder how we allowed this insanity to occur. In 20 years, in 10 years, maybe 5 years perhaps, we'll look back on this pandemic and wonder how so many advanced nations abandoned their sophisticated pandemic plans to follow China's example and lock down entire cities to eradicate a virus. How did we allow the highly compromised World Health Organization to dictate a destructive course of action, one based on China's undoubtedly false data that has caused untold suffering around the world, particularly for the poor and vulnerable, with malnutrition, infant mortality, and child labour rates up in the developing world due to COVID-19 lockdowns? Most of the world, panicked by a new threat and wildly inaccurate modelling, embraced drastic policies and stuck with them regardless of whether they worked or not. To this day, there is very little in the way of evidence that lockdowns work, and there is certainly no scientific consensus. Many experts were ignored or cowed into silence by media and activists who attacked any dissent against lockdowns as anti-scientific, regardless of how well credentialed the dissenters were. World-renowned infectious disease expert Martin Kulldorff explains, he wrote, "Among infectious disease epidemiology colleagues that I know, most favour focused protection of high-risk groups instead of lockdowns. But the media made it sound like there was a scientific consensus for general lockdowns." The Harvard Medical School professor is among tens of thousands of professors, doctors and scientists who signed the Great Barrington Declaration against lockdowns in favour of focused protection of vulnerable people. They wrote, "For society at large, the conclusion was obvious. We had to protect older, high-risk people while younger, low-risk adults kept society moving. Instead of understanding the pandemic, we were encouraged to fear it. Instead of life, we got lockdowns and death. We got delayed cancer diagnosis, worse cardiovascular disease outcomes, deteriorating mental health, and a lot more collateral public health damage from lockdown. Children, the elderly, and the working class were the hardest hit, while what can only be described as the biggest public health fiasco in history." Closer to home, we had the Dan Andrews government and much of the media largely ignore hundreds of doctors who at some personal risk signed an open letter about how Victoria's marathon lockdown was doing more harm than good. But the media is hooked on the scaremongering and the daily hysteria, which explains why the number of COVID cases leads the news. instead of whether the virus is putting stress on our hospital system and ICU capacity. It's why we hear so much about how the Delta variant is more contagious, but we don't hear much about how it's been so far considerably less virulent than the original strain. Throughout this pandemic, we have been told that we must blindly follow the advice of health bureaucrats, and that any questioning of their absurd demands, from banning fishing to lecturing the masses about the ills of browsing to banning Anzac Day flyovers, any questioning of these health bureaucrats was condemned as an attack against science. These unelected, unaccountable public servants may not have the credentials of Harvard professors, but they have been granted sweeping powers, with gutless politicians deferring to their judgement instead of making decisions based on all the evidence. The more one hears from some chief health officers, the more alarmist, catastrophist craziness, the less faith one has in their judgement.